Good morning, everyone. Thank you so much for the opportunity to contribute to a very timely discussion today. I'll be making the case for more PhD-prepared nurse scientists that are needed to advance this work in terms of health equity, including a focus on the social determinants of health. I'm Dr. Janice Phillips. I'm an associate professor at the College of Nursing, but also the Director of Nursing Research and Health Equity at Rush University Medical Center. Critical to our discussion today is the need to ensure that we are building and advancing nursing research that is focused on achieving health equity and from the context of the social determinants of health perspective. And just as nursing worked to advance health disparities research and to make sure that we had a pipeline of nurse scientists to advance health disparities research, we must be vigilant in ensuring that we have a cadre of well-prepared PhD nurse scientists who can advance our work in health equity. The increased focus on the social determinants of health, in fact, is driven by the connectivity to health disparities. And no doubt we need PhD-prepared nurses who can conduct all types of research, be it qualitative or quantitative. We also need a cadre of PhD-prepared nurses who can apply a health equity lens, a culture of health lens, if you will, to research that includes a focus on nursing and interdisciplinary intervention research. Doctors Shrivenson and Shanita Williams from HRSA in their article, Transitioning from a Health Disparities Research Agenda to a Health Equity Research Agenda, outline the need to transition from health disparities research to health equity research. And this paradigm shift will require that we design, implement, and evaluate interventions at the neighborhood, local, community, state, and national levels. Such research will help us better understand and respond to broader structural factors such as the determinants of health, which are contributing to as much as 80% of health outcomes compared to traditional clinical care, which contributes to approximately 20% of health outcomes. Preparation at the PhD level is needed if we, as a profession, are to make this transition as well as advance knowledge that can improve the nation's health. However, the advancement of research in this area, along with the advancement of nursing science, will be greatly hampered if we do not move quickly to ensure that more nurses are receiving their PhD degrees in nursing. That's the research degree that will equip nurses with the necessary research knowledge and skills to advance a health equity research agenda. We are all familiar with the Future of Nursing's recommendation to increase the number of nurses with a doctorate by 2020, in fact, to double the numbers of those who have their doctorate by 2020, and to add to the cadre of nurse faculty with a focus on diversity. And since this initial call to action in 2010, we've made great progress towards achieving this goal. In fact, we are on track for achieving this goal. However, the number of nurses who have received their DNP degree far outweighs the number of nurses who have received the research-focused PhD degree in nursing. Let me show you on this first slide. If you look at this first slide, this highlights the growth in doctoral nursing programs. Starting with 2006, as you can see, our PhD programs started out 103 PhD programs in 2006, but by 2018, there were only 143 PhD-prepared programs. And then when you look at the DNP, there's been tremendous growth in the number of DNP programs. As you can see, in 2006, there were 20 programs. That progressed to 348 programs in 2018. The second slide shows growth in the enrollment rates in DNP and PhD programs from the same time period. And similar trends are noted. As you can see, in 2006, we had 862 DNP programs. When we moved to 2018, that number increased to 32,678. In contrast, when you look at the number of PhD programs, 862 in 2006, progressing to 4,698 in 2018. So tremendous growth there. We've also seen tremendous growth in our BSN to DNP and MSN to DNP programs. Well, what about graduation rates? We see that there's been tremendous growth in terms of the numbers of individuals who have been graduating from DNP programs compared to those who have graduated from PhD programs. Again, looking at the slide in 2006, we have 74 graduates in PhD programs of nursing. In 2006, 74, moving to 802 in 2018. In contrast, when you look at the DNP program, 437 graduates in the year 2006, moving to 7,039 by 2018. So how are we doing with minority representation? As you can see from this slide, when you look at the numbers of DNP graduates versus PhD graduates who are minorities, you can see 34.6% of minority representation of those who have their DNP degrees compared to 33% who have their PhD degrees in nursing. So yes, we are all well positioned to meet our goal to double the number of nurses with doctorates, but still more needs to be done to make sure that we have an adequate supply of PhD-prepared nurses in nursing. And while we do need a better balance between the two, we also recognize the vital role that our DNP graduates play in this space. We partner with our DNP graduates because they can be very vital in our efforts to implement science and other research activities that are vital to addressing the social determinants of health. So in thinking about the need to have more PhD-prepared nurses who can build, advance, and evaluate a research agenda around the determinants of health, we also need to consider what are those competencies that are needed to advance this body of research. In addition to our traditional nursing research courses and competencies that are embedded in our PhD programs, aspiring nurse researchers in this space will need to be familiar with the various conceptual and methodological underpinnings across a wide spectrum of disciplines and even sectors outside of nursing. Developing competencies in areas such as social epidemiology, population health, intervention research, health services research, and even policy analysis come to mind that need to be included or at least accessible through other learning venues. The time is now for us to develop a research agenda coupled with a roadmap for making sure that we have the needed research competencies that will strengthen nursing's contributions to this body of research. We need a more robust supply of PhD-prepared nurses who can advance our work in this area. In strengthening our competencies, a few questions also come to mind. Do we need to supplement the PhD learning experience with other research development opportunities, specific postdocs, courses outside of the health arena, minor electives, or even summer institutes like we did with the Genetics Institute? How will we as nurses engage with multiple sectors and other disciplines in our efforts to build and advance research in this area? Better yet, how will other disciplines and sectors engage us in their efforts to address the determinants of health? I envision a nurse researcher actually working for the Department of Housing and Urban Development, evaluating the health outcomes of affordable and stable housing, or working with the City Council to help them as they integrate a health in all policies approach to policy making. The need to increase the number of nursing students pursuing a PhD degree has also been underscored in the 2016 IOM report assessing progress on the IOM report on the future of nursing. That being said, any discussions related to increasing the number of nurses completing their PhDs in nursing would be incomplete without acknowledging those identified barriers, such as cost of education, the length of time to complete a PhD degree, and the supply of quality faculty who can teach this next generation of nurse scientists. All of these are of great concern. As identified in the IOM Progress Report and other reports, we need to encourage an earlier entry into research careers. We must also stimulate more exposure and excitement about PhD studies, along with doing research to improve the health and well-being of all populations. More research scholar support and developmental programs are needed in our quest to increase the numbers of PhD-prepared nurse scientists. So yes, we do have some challenges, but there are also opportunities to redress the social inequities through our nursing research on the determinants of health. Increasing the number of PhD-prepared nurses who can advance this research agenda is a critical first step towards achieving health equity and charting a path for the future of nursing. Thank you very much.